Medical Watch now. Illinois has its first measles case of 2025. State health officials say an adult in Marion, which is in southern Illinois, tested positive for measles. Dr. Nicholas Cozy is an emergency room doctor at Rush University Medical Center. He has some experience with the measles and is joining us now to talk a little bit more about this. First of all, hello to you.
Good to see you, Lourdes.
Okay, let's talk about what we know of this case so far. We know it's southern Illinois. Anything else that you can tell us about it?
So information right now is very early and preliminary. We do know that one individual in the state of Illinois has tested positive. It's unclear if that person is vaccinated or not for measles. It's unclear the age. However, we can say of the over 900 cases around the country during this epidemic in the United States, 97% of those are unvaccinated. So the money is on this individual is likely unvaccinated, but we shall see.
All right, which tells you a lot about the importance of a vaccine for measles and how effective it can be. So give us a description of what people should expect if they still have not gotten vaccinated and perhaps are taking their child in to get the vaccine.
It's a great question, Lourdes. So the MMR vaccine, extremely safe, 2 doses, one at 12 to 15 months of age, the other dose at 4 to 6 years of age. And as you can see the images on your screen for your viewers, this is a very tremendously concerning infection, measles. It's something that has been eradicated. However, something that we're starting to see much more of, considering the fact of lowering vaccination rates. And it's something that we have to stay on top of.
Yeah, and I think when people hear, look, there's been one case now reported in southern Illinois, they start to wonder, how quickly can this spread? What are you expecting here in the next, few months? Should we be prepared for perhaps more cases popping up?
We should. It's always good to be proactive, and that's our job as emergency physicians, as clinicians, and healthcare providers around the state and around the country. What makes this different, Lourdes, for example, the common flu that many of our viewers just got over can infect one person can infect 3 or 4 people. Measles, one person can infect up to 14. So it's one of the most contagious illnesses that we've ever seen in terms of viruses. Now, in terms of vaccination, we know that the first shot is about 93% effective at eliminating your risk of measles. The second shot, you're looking upwards of 97%. What we've seen around the country in upwards of 900 cases, 97% of those are unvaccinated. Take that to 2024, we only saw about 250 cases, and we're 4 months in, and we're looking at around 900 cases.
Wow. Okay. Are there things that people should sort of keep in mind, perhaps if they're not feeling well, that could give them an indication that it might be measles? What are some symptoms?
So some symptoms that you have to think about: high fevers, cough, runny nose, eye redness, rash that's raised, that's red, that you can almost feel on your hands. It's something that we should be proactive for. It's not something that we should have over concern about, but it's important that as families, as healthcare providers, that we're providing that education for our families, our patients, and our community.
All right. Thank you so much, Dr. Nicholas Cozy with Rush University. We'll see you again next time.
Good to see you.